My dear students, today I would be taking up a very important topic from pediatrics. Multiple questions have been asked from this topic, and this is a topic of immense significance. My today's topic would be Alkaptonuria. So you're already aware the quantum of questions asked from this topic. So as far as Alkaptonuria is concerned, you have to remember some of the very important high yield points about this disease. So as far as Alkaptonuria is concerned, the most important point you have to remember is that it follows an autosomal recessive inheritance pattern. Questions like these are frequently asked: autosomal dominant, X-linked inheritance, autosomal recessive. So you have to remember that Alkaptonuria follows an autosomal recessive inheritance pattern. What is characteristic about this disease is the presence of increased concentration of homogentisic acid in the body and cells. I mean to say body fluids and the cells. So homogentisic acid accumulation is a characteristic feature of Alkaptonuria. The basic biochemical mechanism about Alkaptonuria is the presence of oxide polymers, which bind to a very important component in the body, the collagen. So the collagen binds the oxidized polymers, and this gives a characteristic appearance, which we call as characteristic pigmentation to the connective tissues. And anywhere the connective tissues are lodged in the body, we have got a characteristic bluish or bluish black pigmentation, as I will be elucidating just in a few minutes. The first important characteristic feature about Alkaptonuria is that a patient complains of dark urine darkening on standing. That is classic of Alkaptonuria. In addition, you have to remember that sometimes the sclera can be blackish or bluish black. In addition, the most important fact which can be depicted is the examination of the ear. And in the examination of the ear, you have the ear cartilage, the concha, the helix, and the antihelix, which might be having a bluish or bluish black discoloration. In addition to that, a very important feature about Alkaptonuria is the presence of arthritis, and there might be pain, stiffness, and limitation of movement of certain joints, and especially the joints involved are the hip, the knee, and the shoulder joints. So the features of arthritis combined with the urine darkening on standing are a feature of Alkaptonuria. There might be some rare peculiarities about Alkaptonuria, and what are those rarities? That is the pigmentation of the heart valves, which normally cannot be picked up or diagnosed. So there might be pigmentation of the heart valves, there might be pigmentation of the tympanic membrane, in addition to the calculi, the renal and the prostatic calculi, which also may be characteristically pigmented. So the pigmentation happens to be a very characteristic and cardinal feature of Alkaptonuria. In addition, you have to remember that the name to the pigmentation which we give is classically called as the ochronotic pigmentation. Ochronosis is a characteristic feature of Alkaptonuria. Now, how do we detect this biochemically? The increased concentrations of homogentisic acid can be detected by virtue of Benedict's reagent, as well as the ferrichloride test. And in addition, we can just detect increased homogentisic acid by the presence of silver nitrate test. Characteristically, the intervertebral discs might also be involved, and we can have a characteristic bamboo spine. And in addition to that, we can have degeneration and calcification of the intervertebral discs. So these are some of the important facts about Alkaptonuria. And very important fact to remember is that you can just improve the symptomatology of Alkaptonuria by restricting the diet rich in phenylalanine and tyrosine. So decreased phenylalanine intake and decreased tyrosine intake helps in improving the symptoms of Alkaptonuria. These are the main important points which a student necessarily has to remember about alkaptonuria. I hope that you find these points very important, and this will aid you in answering your questions about alkaptonuria in a very methodical manner. I wish you good luck. Thanks a lot.